Daniel, welcome to Pharmacom's TV and thanks for taking the time to talk to us today. Can you talk about how organisations are developing their business process to deliver more on patient value?
What we see happening now is that we move away from doing or creating solutions for patients in our lab and then coming with a final solution to the patient who need it, to doing things with patients. That co-creation element includes patient involvement much earlier and throughout the life cycle of the solution, because we know that is delivering better outcomes at the end. So we are organizing ourselves differently. We need to have single point of contact. We need to have, for all of the function in our company, a way to get in touch with the patient so that we get that input and we can start co-creating.
And how are organizations effectively measuring the impact of their patient-centric engagement activities?
Well, of course, as I said, the end measurement is outcome, is how are patients doing. And that's of course a long-term measurement. I think what we need to do first is measure exactly internally, did we actually do it? So in the case of Janssen, we have a dashboard and we are looking at the products that we are developing and we are asking twice a year the development team leaders and disease area leaders, did you have patient input in your target product profile? Did you have patient input in your clinical trials protocols? Did you have patient input in your desired patient-reported outcomes? So we are measuring internally if this thing has happened. The impact of that all, the long-term structure of the industry is that before the product reaches the market and before you can start measuring outcomes, that will take a few years, of course. The second level of engagement is really measuring what patients, of course, already give you as feedback, which is it's a low-hanging fruit. If patients really feel, oh yes, I've been engaged, I feel much more respect and more trust towards you, that's a very positive thing to start with. But the real measurement will be at the end of the process when the solutions are on the market and have been used by patients, and we will have a better result, better outcomes. That's where we will be able to prove that it all made sense. What we try to do is we want to go more and more to the direct contact, so we definitely want to have direct involvement of patients, and that can go through patient representation, so through patient advocacy groups, mostly when they're well organized. What do we do? How do we get that? Well, we want, when you have a direct contact, you have a dialogue. And I think part of the dialogue is not just the listening. Part of the dialogue is also the feedback. It has to be a continuous feedback. When people see that they can give input, but they also feel that they have been listened to, that's where you create trust. And when you come back to a patient and say, listen, you suggested we change this, but we cannot change this for very good reasons, that's fine. It doesn't need to be a one-directional dialogue, it's a bidirectional dialogue. But the important part is giving feedback. I think we have during too much time, worked with market research, anonymous, and we just got the input and we did our thing. We never gave feedback. I think that make people feel that we're somewhere in an ivory tower, we're sitting somewhere far away, and we're doing things for them, but without us. And that's gone by, those times are gone. We need to really engage, we need to talk to the people who are actually using the solution, for whom the solution will have a huge impact on their life. I think it's but normal that we do that, but for too many years the industry, out of fear and there are a lot of compliance, and of course we shouldn't be advertising products. Nobody wants to advertise products, that's not the aim. So there are a lot of caveats, but I think we're slowly getting over it. Everybody starts to understand that an engaged patient, again, will come to better outcomes. So if we all agree with that, I think doing this, it makes a lot of sense.